What are the billing issues faced by dental practice? How can ACP help practice to eradicate it?
We do a complete end-to-end project review to understand the revenue leakages. We build the control measures for the practices to arrest the leakages. The claims can be going out as a clean claims, and the denial rate can be drastically reduced.
Hi, my name is Gayatri Anakathil. I'm here with Dr. Charlin Anthony. Hi, sir.
Hello.
Dr. Charlin Anthony is the CEO of ACP Billing Services LLC, headquartered in Orlando, Florida. He will be taking us through challenges and pain points faced by the physician in RCM services and on how to overcome those challenges and pain points. Hi, sir. Let
Hello.
us start with the questions.
Of course.
How can ACP's RCM services help hospitals and healthcare practices avoid revenue cycle inefficiencies to streamline operations and boost profitability?
Usually, when we sign up a new client, a new practice, we have a process in place. We do a complete end-to-end project review to understand the revenue leakages, understand the practice pain points, and the challenges that they're facing. So we create a new dashboard for them and a new consulting report for them. With the next 3 to 4 weeks from the time they start with ACP Billing Services, we create a master project review report, like a consulting report, which gives them a clear insight about the leakages, what are the type of denials, and then also what is the solution to overcome those denials. And also we give them a lot of solutions of how to get credentialed with the payers, so that you can avoid these type of denials. We give them various strategies to build and increase the efficiency of the billing, increasing the clean claim ratio, and then increasing their first pass submission acceptance rate, and increasing their the gross collection rate, the net collection rate, reducing the denial rate, and then also how to identify your revenue realization rate, and also increasing the first pass revenue recovery rate. So when you give them a solution of all these different strategies and bring down the denial rate, the AR percentage rate from whatever $1 million to at least 20% of the overall AR outstanding balances, and then keeping your AR, which is less than 120 plus days, in control, or with the help of a clear strategy, then these things would definitely help a practice to increase their cash flow and reduce the denials, and also make the billing super strong.
So next question, how to ensure seamless billing solutions for physician and healthcare practices?
It's a great question. The practice first needs to have the right team in place, and then the front-end staff needs to do a complete benefit coverage verification, eligibility verification, 24 hours prior to the patient could visit the practice, and then also the doctors should start writing a detailed chart notes in the EHR system, so the medical coding team can evaluate, measure the right codes rather than down coding or up coding, and then understand the list of payers that practice needs to be enrolled, and take immediate actions towards it, so that you can submit a clean claim, and also your claims, when it reaches the payer end, it gets resolved and get paid in a timely manner. And most important thing, every practice, their billing department feels that once they submit the claim from the billing system to the insurance, but there's a middleman program which is called clearinghouse. The clearinghouse rejects the claims, and then it's sitting on the clearinghouse rejections queue forever and ever, and it's not noticed, and nobody touches that accounts. And then after 6 months, if somebody goes and touch that part, and then by the time they exceed the timely filing limit for the claim submissions. So these kind of errors, if they eliminate, I think that would be the best solution that any practice could have, and also can see a major progress in the billing and consistency while doing the billing.
Sounds good, sir. Moving on to the next question. How does ACP Billing help your clients using your physician practice management services?
We build a workflow initially, like once they get on the board and after the induction period and onboarding process, everything completes. We build a new workflow for them. We build some of the best practices and make them like okay to follow it, and also we build the control measures for the practices to arrest the leakages, so that like okay that the claims can be going out as a clean claims, and the denial rate can be drastically reduced. Besides all of that, like now we also help them like not with the overall practice management, how to right from the front desk like now okay till like now the back end department, what every department needs to do, so that like now okay they do not make any mistakes like no while like processing the claims or entering the claims information. And also we also conduct like no like periodic updates and some kind of training sessions for the practices, like no if there is any updates in the coding, we educate the doctors, we educate the office managers, so that like okay they don't write the same codes, or they like no when the doctor is writing the chart notes like no so he can change those codes, and then he can follow the new instructions, so that like no the claim can be paid on time. So all of that like now we educate the providers, and we put that as a part of the best practices that we write for the practices. And also we give them a new standard operating procedure guidelines which the practice needs to follow it, so that they can be more successful in running the practices, and also increase the cash flows bottom line.
Moving on to the next question. What are the billing issues faced by dental practice? How can ACP help practice to eradicate it?
Great question. Most of the dental practices, like they have major staffing issues, and then also another major problem that they face is like the coding issue, because the dental coding is different from medical coding. So the CDT codes, like the current dental terminology codes, that's completely different from the the medical codes that what we use it as CPT or diagnosis codes. So when you use CDT codes, you need to be very specific about like what modifier you're using. Are you using the left upper tooth modifier, or right upper tooth, or left lower tooth modifiers? Like those modifiers really matters a lot. So you need to have a proper chart, like the diagram of like which describes about like the right modifiers to be used like while submitting the claims or coding the dental claims. So we help like dental practices like in educating them, and our certified coders are certified even like with the dental coding as well. So that helps like the dental practices to avoid like major coding denials, and as a like to help them with the staffing issues, like we cover the practice with not only with one biller or like with one dedicated resource. Now we give them a team of resource, like where like everybody would be helping them as a team, and act like a buffers. Even if one person like goes on a leave or vacation, or like medical sickness or something, then definitely like the practice as like okay 6 or 7 people okay who knows the process, who knows the project specific standard operating procedure guidelines, who can still like help the practice ongoing with the billing and everything, so there is no like delays in the turnaround time for the claim submission or working on the denials as such.
So what is the usual cost of billing errors in dental practices?
Usually, as per the industry standard, the accuracy level should be maintained 95%. But however, like due to lack of billing knowledge, and then like inefficiency, so that has increased from 5% to 14% right now. Okay, so that is like it's a big it's a big loss for the dental practices. So to cut down that rate, like you need to have a right team, okay, who has like strong billing, dental billing and dental coding knowledge, and also like your like credentialing should be up to date, okay, so that like you can get paid from all the like you can be covered by with all the commercial and federal dental plans, okay. So these are the things like which can help you to see better results in your billing.
So, sir, can you tell us how can ACP Hospital Billing Services help your clients' billing complexities to simplify their revenue cycle and reduce administrative burdens?
Usually, with hospital billing, they have a lot of AR backlogs and coding issues. That would the major coding issues causes a lot of denials and increases the AR outstanding balance percentage. So what we do is we create best practices for the hospital billing, and we also build a workflow and process and systems in place to make the billing more simple and make it more like a process dependency workflow rather than people dependency workflow. And then also we understand the complexities and the root cause of the what is causing those complexities, and then once we identify those areas, we help them to build a new workflow that can streamline and help them to see some great results.
So, moving on to the next question, how much time and resources could a hospital save with tailored billing services by ACP?
We provide end-to-end revenue cycle management services as well as a la carte services. It depends on the need of the hour, what a hospital wants us to work on. Usually, hospitals they have a big problem with the AR outstanding balances. They would not have the right resources to work on those backlogs, or maybe it's a time sensitive issue where they wanted to clean up everything within the timeline so that the timely filing exceeding issues can be eliminated, or appeal filing limit exceeding issues can be eliminated. So when they come back to us, we identify the right resource who can help them out, and we put the not only the right resource, we also bring the right number of resources to work as a special project and cleanup project to help them out to clean the old backlogs. And then after that we will help them to maintain the consistency of the AR buckets, and also with the coding if they want us to do the help them out with a DRG codings drug related group codings, or inpatient coding, and then we bring in the certified inpatient coders to help them out to clean up the backlogs, because if your coding is accurate, then your denial rate is completely reduced, and then your error rejection rate and or denial rate can be maintained with less than 1%, and your clean claim ratio can be increased to 99%. So this is how we are helping them out.
Thank you, Dr. Charlin Anthony, for being here and sharing your insights on the complete end-to-end RCM services.
Thank you, and it's a great honor for having me here. And also, it was a very useful session, whatever we discussed, and by having this meaningful conversation, so a lot of practices could be benefit out of this, and also they can contact me at any time, for a free detailed practice management consultation, which I'm willing to do it for free of cost, and you can also provide my information to them. So that's it. Thank you.
Based on what we have discussed here, I believe this would help a lot of practices to build a strong workflow and efficient team to streamline their practice goals. Anyone watching this video, if you need a free practice management consultation, please click on the link below and fill in the form to schedule an appointment with Dr. Charlin Anthony. Stay tuned for more videos.